Hello everyone, it's Dr. Anne and welcome back to the Health Hub. I am back with another video on contraception. So if you haven't watched my previous video on natural, non-hormonal methods of contraception, make sure you quickly go watch that video first and then come back to this one. So without wasting any time, let's get to hormonal methods of contraception. Just a bit of a recap. Remember I mentioned that contraceptives work at different levels. The 4 areas that I already mentioned in my previous video. So it works at the level of the egg, preventing ovulation, at the level of the tube, preventing motility of the fallopian tube, and at the level of the womb or the endometrium by thinning it out so that the egg doesn't attach well. So basically making the environment less favorable. And at the level of the cervix by thickening cervical mucus so that the sperm is not able to, so that the sperm is unable to swim effectively and therefore preventing pregnancy in that manner. The first method of hormonal contraception that I'll be talking about is the pill. This method plays on the estrogen as well as the progesterone levels, therefore creating a negative feedback back to the brain to tell the brain to stop producing the luteinizing hormone as well as the FSH. So in that way, it prevents ovulation. So the pill is thought to be 0.3% effective when used effectively and correctly. But when it's not used correctly, the failure rate can be up to 8%. Some of the contraindications to using the pill: if you've had a previous stroke, some DVT or some clotting phenomena, if you're a smoker, have uncontrolled hypertension, or if you have diabetes, because it does affect insulin sensitivity, and because the pill is metabolized in the liver, if you have any liver problems, cancers that are estrogen dependent, and cancers that are of the breast are also a contraindication to you getting the pill. Now, the nice thing about the pill is that it's non-invasive, it's freely available, it's easy to take, easy to remember depending on the type of lifestyle that you have. It also can help regulate your periods, assist with things like acne, hormonal acne. And the pills that are out there and are available are the combined oral contraception as well as the mini pill, which is the progesterone only pill, right? So the combined oral contraception is a pill that contains both estrogen and progesterone. It comes in different formulations. Let's start with the ones that are actually found in public. In public, you get Trussell. So it's a 28-day pill, 21 of which are active pills with hormones, and 7 of which are the hormone-free or placebo pills that you take, which is the pills that will result in you getting or shedding blood or getting your period. It has 3 different levels of hormone formulations, hence why it's called Trussell. It's free in public. Some of the side effects with Trussell have been, basically mastitis or painful and enlarged breasts. According to the NHS, they did research to find if actually the pills caused weight gain, and they found that they actually don't cause weight gain. So yeah, so weight gain is not a side effect of the pill. Trussell is one pill. It's not necessarily one that's really good in terms of assisting with clearing up acne. So there's other pills that are better at that, but it's also an option. The other one in public is Overall, which is monophasic. The nice thing about the monophasic pill is that it's the fixed dose of 21 pills with a hormone-free pill. And the nice thing about these pills is that you can sort of maneuver your way through them. So if you're going somewhere or won't be able to, can't afford to get your period, you can literally skip the 7-day period. Don't say I told you this. Basically, you can skip the 7-day period and just move on to the next packet, thereby skipping your period, and basically it gives you control over your period. Whereas with the triphasic one, because there's different doses, it sort of messes everything up. So you can't really, do that with that pill. And then there's also Overall in public, which works just as well. It's also for free. So the other thing that some women might experience, if you already are with someone with migraines, then the pill is not something that's really good for you, especially migraines that are sensitive to estrogen levels. The headaches can become worse with you using the pill. So I guess it's something that you have to then think about and consider maybe other methods that are hormone free. So in public, I mentioned the two most common pills that I used, which is Yaz and Yasmin. They retail for around 195 to 200 Rand. But with these pills, you have to see a GP or medical practitioner to write you a script. If you can't afford to go to the doctor, the nice thing is that you can go to a public hospital and actually see see a doctor in public for free and ask them to write you a script if you actually prefer the private pills, and they can do that for you. And then the only cost that you will incur are the costs of actually having to buy the pill. So Yaz and Yasmin are good. They are used for the skin. The best pill that actually assisted with hormonal acne was actually Diane 35. Now Diane is the girl that she thinks that she is. Like, it'll clear up your skin so fast and so effectively. It's also around 195 to 200. Let's say you don't have like a full medical aid and you have a hospital plan. Oral contraceptions are covered by most hospital plans. You just have to call them and find out. The mini pill, which is progesterone only pill, this pill can be taken by breastfeeding mothers, whereas the combined oral contraception that contains estrogen cannot be taken by breastfeeding moms because estrogen affects breast milk production. So it's better to take the progesterone only pill if that's a method that you prefer. The only problem with this pill is that it's less effective than the combined pill. It's around 0.5% failure rate compared to the combined pill, which is 0.3% failure rate when used correctly. So yeah, that's the only issue with the mini pill. And this pill, it's not forgiving. You have to take it at the exact time, not 3 minutes later, not 6 seconds later, literally at the exact time every day. So this method you can get both in public and private. So if you just don't want the injection, which is what they give you after birth, then you can just discuss with your doctor and they will then offer you the mini pill day. So let's say you forget to take the pill. So you just take it the next day or as soon as you remember, and then continue then taking it. But don't be like some people I know, or guys, like who will miss the pill for 3 days and then quickly take 3 pills at the same time 3 days later. That's not right. Put you at a risk of, exposing your body to too much estrogen, which can basically increase its side effects and possibly lead to complications. So if you end up forgetting it for basically 2 consecutive days, then you have to use barrier methods of contraception like a condom to try to prevent you from falling pregnant for 7 consecutive days up until your hormones reach peak. It's almost just like how it works when you get on the pill. You can't start the pill today and expect cover right away. So you have to wait for at least 7 days for the pill to reach steady state level, and then only thereafter can you actually rely on it or safely say that you are protected. Deep vein thrombosis. So basically clot formation in the deep vessels of your body and then shoot up to your lung and can result in death and some people have actually lost their lives to this. So according to FDA research, 3 to 9 women out of 10,000 will develop a clot. Not all the clots will result in pulmonary embolism, which means the clot basically shooting up to your lung and thereby resulting in death. So it's quite a rare complication of the pill, but it's also quite tragic. So if you're someone who has risk factors to maybe clotting, maybe they have a family member with a clotting disorder or some genetic predisposition to you forming a clot, then you have to stay away from the pill. Also, if you have cancers or are immobilized and are not, active or walking for long, because then your blood is not moving, and therefore stasis of the blood can then result in you forming clots, and thereby the clots shooting up to your lungs. So basically the other method that's available is a transdermal patch. It releases hormones through the skin, and basically you pick where you want to have it pasted. So the material is extremely sticky and won't peel off. Normally the patches will stay on for 7 days, and you'll get 3 patches for the month, and just change it then you'll just have to change it every week. You'll have 3 weeks of the patch and 1 week of a patch free, one patch free week, and that patch free week is the week in which you would experience the bleeding. So the nice thing about the patch is that you can just put it on and forget about it. Are available both in public and private, but in terms of public availability, it's only certain facilities. And then there's the vaginal ring, which is a soft ring that's inserted, and it contains progesterone. It's also inserted for 3 weeks, that 1 week hormone-free week. And some of the problems with the vaginal ring that have been found has been, delayed return of fertility, and it can also cause breakthrough bleeding or spotting. So it's just as effective as the pill in preventing pregnancy. The other thing that's available as hormonal methods of contraception is the injection, and it's one of the most, it's the most commonly used method of contraception in South Africa. The injection is more effective than the pill. The injection is 94% effective in preventing pregnancy. You don't have to think about it. So basically there's 3 types of injections: progesterone only injections, which is the Depo Provera, which lasts 3 months. So you basically go for the injection once every 3 months, and then the neurosteroid in public, basically, which is once every 2 months. And the other injectable method that you get is the combined injection, which you get every month, basically. So you have to go see your doctor or nurse every month for that injection. And that injection works like the pill, so it contains both estrogen and progesterone, whereas with the 2 injections that I already mentioned, only contain progesterone. So that's why most women in public facilities, after giving birth, they're given the injection, because it won't affect breastfeeding in any case. So in public they are free, whereas in private there's a fee that you have to pay, both for the consultation and for the administration of the medication. Some of the biggest issues most people have experienced or will experience with the injection is acne, weight gain, hence why there's a stigma attached to it that it ruins bodies, and that's because there's just a drastic change in weight. Okay, you might then experience a bit of changes in your muscle tone, and that can be fixed by just going to the gym to get toned. So the injection is both effective and basically low maintenance, because you don't have to remember to take it. You literally just have to go to the facility to have it, to get the injection. So I think that's the most annoying thing about being on the injection, is the fact that you have to take time off to go to a doctor or go to a clinic to have it administered to you. So the Implanon works just as as well as the injection. It also contains the same types of hormones, which is progesterone. So it's a small silicone rod that gets inserted on of your non-dominant hand. So basically it lasts for around 3 years. The problem with this method is that it basically depends on the skill of the person who inserted it, that you find that it's either too deep, basically in the muscle, or damn near the bone, whereas it's supposed to be just subdermal, just under the skin, because you're meant to be able to feel it. Other than that, if it's inserted correctly, you're not meant to get any problems with it or have failure or experience failure with it. The only problem with it is that just like the injection, it can cause acne, and it can also cause breakthrough bleeding. The annoying thing is that also having it removed, you have to get that small cut again, which is basically less than a centimeter, to have it removed. And the thing with the Implanon, spotting for like months. Very important that the moment you experience that whole spotting situation, you just have to go to your doctor. There's a pill that they'll prescribe for you to, and fertility returns almost immediately after it's removed, especially with the injection as well as the implant. Some women might experience delayed return of fertility when it comes to these methods, and it can go up to a year. So the IUCD is an intrauterine contraceptive device. It's basically also known as the loop. It's inserted by your doctor in a business, basically in their office. You don't have to go to theater for it. It's ideally inserted during menstruation because your cervix is a bit softer, makes easier access to your womb. So the device is inserted through the mouth of your womb or your cervix to the uterus, and it sits there and prevents pregnancy by basically creating a septic type of inflammatory reaction. So it's not that you have an infection, but it creates some inflammation in the womb so as to prevent attachment of the egg. And also by creating this form of inflammation, there's also macrophages that will gobble up the sperm before it reaches the egg. The cost in private is around 3,000 Rand for everything. In public, it's done for free. It's not done under any form of anesthesia. Basically, you get there and you're only given pain medication after. And the pain lasts literally 6. So there's 2 types that I'll be mentioning. The non-hormonal one, which is the copper T. There's also the hormonal one, which is the Mirena, which releases progesterone. It lasts around 5 years. Advantages of using the IUD is that it is safe, and it's one of the most effective methods of preventing pregnancy. It is contraindicated in women with an infection of the womb, heavy bleeding, suspected pregnancy, or who have cervical cancer. So the problems with this method initially will be basically the spotting, low abdominal pains, period-like pains after it's inserted. And the other thing that the partners might find problematic is the sensation of the string, because the string has to hang and be visible outside of the cervix. And you have to basically from time to time feel for the string. Ectopic pregnancies, but that's extremely rare. Okay, for a more permanent solution, you're looking at sterilization, also known as tying of the tubes. You actually block the fallopian tubes, and this ensures that the egg and sperm do not meet. If you're looking for something that's a bit more long-term, the IUD is the one. And this method is normally done and performed in theater. So with most women who have decided that they want a certain number of kids and they end up getting a C-section, you have to notify your doctor prior to the operation that you want them to tie the tube thing, because the womb is already out there during a C-section anyways. So it's not like they're cutting anywhere extra to try to tie the tube or get access. The way in which it's done is that in facilities that are more advanced, or public facilities that are more advanced, it's done for free, and you just have to go to the gynae clinic for booking. So basically, the laparoscopic version is much easier compared to if you exposed to a facility that doesn't have access to that, or the person that's skilled enough to do that. Then they end up making a small cut in your lower abdomen and then tying your tubes. So most medical aids will cover this, as well as hospital plans. So yeah, I hope this was helpful to a lot of people. I hope you all gained a bit of information about things that maybe you didn't even know about or weren't aware of. And the whole purpose is just for everyone to be more informed, so that you don't fall into the trap of unwanted pregnancies or unplanned pregnancy. Yeah, so thank you for watching. Do like, comment, subscribe, hit the notification bell, And then I'll catch you on my next video.